Africa's Health Revolution, Why Self-Reliance Matters. CPHIA 2025 Insights. Last week, something historic happened in Durban, South Africa. Thousands of health ministers, researchers, innovators, and gathered for one purpose, to declare that Africa's health future will be written by Africans. The Fourth International Conference on Public Health in Africa wasn't just another summit. It was a turning point, and if you care about global health equity, you need to understand what happened there. I'm speaking to you today not as an expert on African health systems, but as someone committed to learning, listening, and supporting African-led solutions. This is what we learned. Let me start with numbers that should shock you. 70% of all maternal deaths globally happen in sub-Saharan Africa. That's 7 out of every 10 mothers who die during pregnancy or childbirth. 56% of deaths in children under 5 years old happen in Africa, despite the continent having only 30% of the world's population. These aren't just statistics, these are mothers, daughters, children, lives that matter, lives that could be saved. For decades, the global health system operated on a colonial model, decisions made in Geneva, New York, or Washington, solutions designed elsewhere, implementation imposed from outside. But as South Africa's Deputy Minister of Health, Dr. Joe Fala, declared at the conference, every decision we take here must move us closer to health equity, economic inclusion, and social justice. That applause, it was for a revolution. Here's what's changing, and it's happening fast. On October 1, 2025, the African Medicines Agency became fully operational. This is huge. The AMA means Africa can now harmonize regulatory systems across the continent. It means locally manufactured medicines can be approved faster. It means African researchers can lead African solutions. Local pharmaceutical production is expanding. Rwanda, South Africa, Ghana, Egypt, they're not waiting for medicines to be shipped from Europe or Asia anymore. They're making them. But here's what's even more powerful, the conference emphasized community-led solutions, because healthcare doesn't start in hospitals, it starts in communities. Dr. Jean Kasia, Director General of Africa CDC, framed it perfectly, quote, CPHIA is a vital part of ongoing efforts by African countries to build stronger, self-reliant health systems. Self-reliant doesn't mean isolated. It means partnerships on equal terms. It means African leadership with global support, not global leadership with African implementation. So what does this mean for organizations like New Oasis International Foundation? It means we have to fundamentally rethink how we work. Old model, identify problem, design solution, implement, leave. New model, listen, amplify local solutions, provide resources African leaders request, stay committed long-term. We're not saviors, we're partners, and partners listen more than they talk. The conference theme was, Moving Towards Self-Reliance to Achieve Universal Health Coverage and Health Security in Africa. Every word matters. Moving towards, because this is a journey. Self-reliance, because sustainability requires ownership. Universal health coverage, because healthcare is a human right. Health security, because epidemics don't respect borders. At New Oasis, our cross-border model has connected young leaders from Miami to Sao Paulo. Now we're asking, how can we extend that model to support African innovators on African terms? Not, how can we help Africa? But, how can we support what Africa is already building? That shift in framing changes everything. This conference wasn't happening in isolation. South Africa currently holds the G20 presidency. In November, they'll bring these priorities to the global stage. For the first time, African health sovereignty will be a central topic at the world's most powerful economic forum. The next generation of African health leaders is being trained right now in universities across the continent and community health programs. and research labs building solutions the world has never seen. That 70%, that 56%, those numbers can change, they must change, they will change. But only if the global community understands, this is not about charity, this is about justice. African health leaders have declared, we will no longer wait for external actors to solve our challenges. At a new Oasis International Foundation, we're listening, that we're learning, and we're committed to supporting this movement toward health sovereignty. If you're a foundation, a donor, a policymaker, ask yourself, are you supporting African leadership, or are you perpetuating dependency? The answer to that question will determine whether we achieve health equity or simply maintain the status quo. Follow us for more insights on global health justice. Thanks for watching. Let's build a healthier, more just world together.